Hello and welcome to a whole new edition of the H-Man podcast. Today we're going to talk about shockwave therapy. What does it do? How does it work? Evidence about how does it work and its efficacy with various conditions. So without further ado, let's jump right into it. Effects on tissue regeneration. Shockwave has been studied with various conditions. So it's been proven that an effect on it has an effect on the extracellular matrix synthesis in chondrocytes. Chondrocytes are the cells of the articular cartilage. The cartilage is the part that wears off over time in osteoarthritis of the knees or hips. So it was found that it helps to increase the synthesis of chondrocytes. Control of knee joint inflammation and enhance collagen type 2 synthesis. That's another study that found that there is a control of inflammation and enhance collagen type 2 synthesis. And as you know, collagen is found in abundance in every type of tissue in the body. It's the main type of protein that forms our tissues. So shockwave has an effect on that and it enhances its synthesis. So that's actually a very, very quality effect. Also, extracorporeal shockwave therapy pose better analgesic effect and functional score improvement in the treatment of knee osteoarthritis than hyaluronic acid and non-steroidal anti-inflammatory drugs like Advil or ibuprofen. So even it has a better effect than an invasive injection like hyaluronic acid or taking a non-steroidal anti-inflammatory, which is Advil or anything that may be prescribed like ibuprofen or anything on this kind of family of drugs. So also, this is a really nice research because if they studied if you combine shockwave therapy with adipose tissue stem cells has a better effect than the umbilical cord stem cells. And that is research that is found on nih.org.gov. Sorry. So it is on the NIH. You can look it up yourself. You check out ESWT and stem cells. Just type those in NIH website. You'll see the effect there. You'll see the research in detail. There's another study shows that shockwave helps to the resorption of the calcified tissue in the shoulder. So in that case, if there is someone having a chronic tendinitis of shoulder muscles, for example, rotator cuff, any of the tendons of the rotator cuff, if the inflammation stays there for a long time, the body starts to try to block this inflammatory process through calcification of this tissue. So this way, because the body can find a way to stop the inflammation. So in a later stage of chronic inflammation of the tendon, which is wear and tear of the tendon, calcification happens. So shockwave actually helps to resorb that calcification and start a new healing process within these tendons. It's a very good quality effect. Also, it's found to be an non-invasive alternative treatment for rotator cuff lesions with shoulder stiffness. Okay, here are some of the the references. You can see all of them from NIH. I didn't put all of them because there is countless numbers of shockwave therapy research, and because it's a really good modality, it helps with a lot of cases. It's non-invasive. It does not cause any side effects. So that's one of the good. That's why it's been very, very popular in the recent years. So another research shows that shockwave therapy reduces pain in the short, mid, and long term for plantar fasciitis. And if I talk about plantar fasciitis, it is actually it's a key modality of treatment plantar fasciitis in sports injuries, and that is really also a quality uh, effect from Shockwave. Another effect, which I actually didn't know, when I did my research, I found this one, and there is one research also shows the effect of healing of the ligament graft done for post ACL reconstruction. In the first 6 months, there is a benefit of using Shockwave which helps the healing of the graft, which is done in the ACL reconstruction. Very good effect as well. So there's also another meta-analysis, meta-study that shows that, and systematic review that shows that it helps with plantar fasciitis, elbow tendinopathy, Achilles tendinopathy, rotator cuff tendinopathy, and has no side effects. Okay, so now going to treatments that I personally worked on as a clinician, and I saw how the patient improve over time with the use of shockwave therapy. However, I would tell you that I never used shockwave therapy as a standalone treatment. We always combine it with a comprehensive treatment and rehabilitation program. We use many different techniques alongside exercise, and shockwave is one of these treatments. So very good effect, I have to say, with pain, with knee osteoarthritis. We've tried it many times. I had one patient who had a severe case of osteoarthritis, and Shockwave was really instrumental in controlling her pain without using medications or anything like that. Plantar fasciitis, number one, that is the top modality that helps plantar fasciitis, sometimes even better than injections. And if you do injections, it's basically you halting. If you do a steroid injection, you're halting the inflammatory process. You need that inflammatory process to regenerate the tissue. And that's what exactly Shockwave does. It accelerates that inflammatory process and brings it into the healing process. The other two stages, the proliferation stage, then the healing and remodeling stage. So plantar fasciitis, Shockwave is an excellent option for it. Also, we see I've been using it with some neck and low back pain cases, and I use that exclusively for the trigger points, the muscle spasms, and the acoustic shockwave effect of the shockwave therapy does release these muscles and alleviate pain. It also works great with muscle tears. We have used it in Theracave on hamstring tears and calf tears. These hamstring and calf tears were scanned via ultrasound before and after, and we saw the difference over the course of 6 sessions. Rotator cuff shoulder pain that is coming from rotator cuff tear or tendonitis, also impingement syndromes, has a very, very strong effect on that. So that has been treated in the office. I also treated piriformis syndrome and sciatica. So it's piriformis syndrome and sciatica. Usually, it's hard to treat the piriformis because it's a really deep muscle. It lies below glute fat, then the glute muscle, then you have the hip rotators, which one of them is the piriformis, and then you have the sciatic nerve passes under the piriformis. If the piriformis is tight, then it kind of the piriformis muscle spasm also contributes to the pain of the sciatica. Shockwave therapy is an excellent modality because it penetrates deep and helps to alleviate this muscle spasm, brings also the natural endorphins, and it relieves pain. Tennis elbow and golfer's elbow also been treated through with Shockwave. So those are some examples of the treatments that I personally, as a clinician, worked on with Shockwave and seen great results. So how does it work? So pain reduction, it helps with pain reduction. It increase metabolism at the cellular level. It revascularize the tissue and aid in recovery of normal muscle tone in various disorders. So it recovers the muscle tone in different various disorders. For example, muscle spasm due to low back pain, or piriformis spasm due to sciatica. And then muscles usually are tight in response to pain. So it's a kind of like a vicious cycle. So one, if the muscle is tight, then the pain is there, but the muscle now is causing pain by itself. So Shockwave helps to release that. So it works through the acoustic shock wave, breaks down the calcific tissue in the body and aid in the regeneration of new tissue. It also stimulates the process of regeneration through microtrauma that allow proliferation and reset of healing process. If it's a chronic inflammation, the body is kind of stuck, unable to resolve that inflammation. The microtrauma brings the early stage of the inflammation so it can speed up the and move on to the next phase of healing. So that micro trauma is essential because it draws blood flow and helps to heal the chronically inflamed tissue. So, as a patient, like if you want to start shockwave therapy, what to expect? First of all, it has no side effects. However, in very, very rare cases, we don't use it if there is an implant or something like that, but or like there is a type of infection. But other than that, we don't. There is no side effects or contraindications. Treatment takes 5 to 10 minutes per area. So let's say we work on the piriformis, that will take maybe 5 minutes, and then sometimes we will address more than one body area related to the same condition. That's why it's not a standalone treatment. You need the assessment to understand the condition and then target the shockwave towards it, and then perhaps improve the function and start the rehabilitation process. 6 sessions minimum, in my opinion, to have a true response, and that also depends on the condition. So, like if someone has plantar fasciitis, I would say 6 sessions, which basically will be 3 weeks or 4 weeks time, like type of course of rehab. Some people will report some discomfort during treatment. However, from my own personal experience, maybe like the first few seconds become slightly uncomfortable. But as the treatment progresses, it does not feel as bad, and especially the second and third session, it feels like normal stimulation to the area, like pulsation, and very rarely when we find someone who can't tolerate the treatment. If you have any questions, please let me know. I'm going to put my information in the description. Thank you for watching. I wanted to make this brief and short, and I'll talk to you next time.